This podcast is for you, the modern man. I'm Dr. Truong, your host. I'm an intimate health medical doctor and best-selling author of the book Erectile Dysfunction Fix. I'll do a deep dive into sexual health and performance and how it affects men of all ages and backgrounds. So let's get started, and be sure to visit my website at sexualhealthformenpodcast.com for more information and resources from the show. See you on the inside. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Truong, and I've been treating men for issues like this for over 25 years. As a board-certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer, and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often, and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get 2 of these strips, which you will use along with simple instruction to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problems with circulation and heart health, this can also be a great way to prevent heart-related problems such as strokes and heart attack. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. There is one primary pathway to restoring sexual function. And what is that? To reverse a condition or a problem, you have to treat the cause of the problem. So what the slides are saying is that the more you do it, the better you are. So essentially, men that report intercourse less than once a week develop ED twice the rate at men who reported intercourse more than once a week. You don't use it, you lose it. And the difference between ED, between psychological and physical, is that the physical part takes time to develop. So usually present as like you are able to get an erection, but you lose it. But you lose it during intercourse or after penetration. And psychological is really more sudden. It appears within weeks or months, and that you're able to get morning erection or you're able to masturbate when you're with a partner. You're not able to do that. But just going over briefly, risk factors for men are over 40 for risk factors for ED. This was done by a study in 2001. Race is more in African American and Hispanic, and then white. Education is less than high school. You're more at risk for ED. Marital status. This is interesting. Widow. Men that are widow are more at risk. Then the next is divorced and separated, and the next is never been married, and the one that are married are actually the least at risk. Smoking status, we know that smoking is not good. So if you're a current smoker, you're in the worst shape, followed by former smoker or never smoked. Your body mass index is over 30 BMI, and you can put in your weight and your height on the internet and calculate what your BMI is. And interestingly, if you have blood pressure and you take medication, you're actually more at risk to getting ED, because those that are have treated blood pressure are more at risk compared to one that's not treated and compared to one that doesn't have high blood pressure. And the other part is high cholesterol. I don't know why that moved there, but let me move it back. The other part is high cholesterol and diabetes, which increases 4 times your risk of heart disease, as well a history of heart disease, as well as history of prostate enlargement. Just very briefly, I'm just going to go over the physical causes, extensive list right here. It's essentially nerve diseases such as spinal cord injury, multiple sclerosis, penile fracture, Peyronie's, and then the hormone problem, like hypogonadism, low testosterone, even hypothyroidism, and stress. Stress causes adrenal disorders as well, liver disease, kidney disease, and then the drug, the medication, the anti-blood pressure medicine, the antidepressant, antipsychotic, and recreational drugs and opioid pain medication. And then the psychogenic factors that I had stressed, which is traumatic past experiences, relationship problems, general anxiety, depression, and stress, lifestyle factors, obesity, smoking, watching TV, meaning that you spend a lot of time watching TV, you're not exercising, sleep apnea, untreated sleep apnea, and a restless leg syndrome, and the other is prostate disease. This is just if you are taking any of these medications, take a picture of this, but these medications can actually contribute to your ED, mainly antidepressant, anti-ulcer medication, beta blockers, or the medication that you take when you have heart disease, and diuretic, or it's a water pill, and a tranquilizer, and medications such as Postcard, or medication that prevent hair loss. All right, so we talk about, I just wanted to show you schematically what blood flow restriction is like, and how you can have blood flow restriction from high cholesterol, which you see on here, and how it's affecting your heart. So having a heart attack, it's essentially having the ED in your penis. It's similar to like a penis attack, right? A heart attack is the same way. You're not getting enough blood flow to your heart. So ED is the blood flow problem. So not good if you have ED, because if you have ED, it's a predictor of heart disease in 7 to 10 years. Why? Because the blood flow problem still exists. And ED is a sign that your body is inflamed, and that tell you why that, affect the penis first, because the artery in the penis is about 1 to 2 millimeters, the smallest in the body. So when you have ED, guys, it's a sign that you start to have a blood vessel problem, a vascular problem. It's a window into your health, all right? So it's a window into your health. Knowing that is gold, because you can start reversing it when you start having ED. So the pathway to get your sex life back is to treat the causes of poor blood flow that lead to ED. And that one of that pathway is using the 6 system that I mentioned before. The 6 easy steps to get hard to sexual approach to sexual restoration. Well, how do you do that? Well, for those of you have a camera right now, take this picture you have on your phone, because I am laying down the steps now on the 6 easy steps to get hard again. So follow along with me here. There's a lot on this slide. Let's attack number 1, the brain. All right. Remember I told the brain, the 5 senses in the brain, with what you see, what you smell, what you taste, what you hear, and what you touch, well, let those stimulus go through your brain. Use the sensory stimulus that you have, and you can, be relaxed, get in the mood, use your five senses, relax your mind, calm your mind with breathing. Now listen to this, take notes on this. How do you calm your mind with breathing? You breathe in and out through your nose, all right? So you do box breathing. Box breathing is you hold for 4 seconds, you breathe in to 4 seconds through your nose, you hold for 4 seconds, you breathe out for 4 seconds. So how you calm your mind is that you do that breathing. Now this breathing is known to relax people, and you want to be in the moment. You want to have at least 7 hours of sleep, because when you have 7 hours of sleep, your brain reset, your hormones reset, your body heals. You have a calmer mind when you sleep. You definitely want to have REM sleep. Have at least 3 hours of REM sleep. How do you know you have REM sleep? REM sleep is REM, rapid eye movement, is that you start dreaming, right? So if you don't get enough sleep, your brain's not going to be calm either. So how do you calm your mind? Is through breathing, is to be able to use your five senses. Number 2, emotion. Decrease your stress. Try to decrease your stress as much as you can. Stress, I know, is part of life, but it's how you perceive the stress. Again, the breathing. The nasal breathing will help you also actually with premature ejaculation. It will also help you with not thinking about performance. A lot of times, when I'm treating my patient with ED, they think that, okay, I'm with my woman, I should be ready to get, erection within a few minutes, but they're not thinking about it. They're stressing about how their penis is going to be. They're stressing about, am I going to be able to get firm this time, or am I going to lose it? So they're thinking about it so much that they're not relaxing their mind at all. So decrease the stress, do your breathing, get the sleep, because sleep is so important, not only for your mind and for your emotion as well. And get your hormone tested. If you have ED, get blood work. Go see your doctor, get blood work, because I can't tell you how many times I diagnosed my patient with new onset diabetes, with high cholesterol, with severe inflammation. And they'll come in, their blood sugar is like 200. The hemoglobin A1C is like 12, and they haven't get blood work done in like a decade. And they've been taking ED medication. That's like the most dangerous thing you can do. So first thing is get your hormone measured by blood work, and get your sleep. Again, sleep restore your hormone. Your testosterone is made when you're sleeping. Testosterone is made in your testicles. And that's when you sleep, it's how it makes more nerve. The fourth part is nerve. How do we fix the nerve? We take the nerve with shockwave therapy. We'll talk about what shockwave therapy is, and with platelet-rich plasma, using your own stem cell to help restore the nerve and the blood vessels again. And certain supplements, and using peptide and Botox. Botox is the next upcoming thing. I know the Botox that women get on their face for wrinkles, making them look young again. Well, you can put Botox now. You can get injected Botox now into the penis, and what it does is that it will help with the nerve. It increases blood vessels, with the restore blood flow, as well as relax the penis muscle. So it's kind of like a better than Viagra. It's natural, and it works on the blood vessels and the nerve at the same time. How do you treat the blood vessel? To treat the blood vessel by increasing your nitrous oxide. Remember what I said how you increase your nitrous oxide? Eat more leafy green, and stop using fluoride toothpaste and mouthwash, and stop taking the antacid, all right? And again, using your own stem cell from your blood, platelet-rich plasma, shockwave therapy, Botox, stop smoking, drink moderate alcohol, because alcohol is very inflammatory to your endothelium. It actually will affect your blood flow because alcohol is toxic. You should moderate that. I would suggest about 10 drinks a week, all right? And that includes mainly hard alcohol and beer and wine to restore your endothelium again, is to be on a Mediterranean diet. Mediterranean diet advocate more of lean meat like fish and chicken, just a red meat only once a month, and eat more vegetables and fruits. Exercise is high intensity interval exercise or HIIT. All right. You may even have to do that. You may just walking 30 minutes a day is enough. You don't have to do like HIIT either. As long as you get some type of activity, all of those restore the endothelium and your blood vessels again. That will help with increasing the blood flow. The last part is the muscle, the penis muscle. How do we restore that? Remember I talk about how you don't use it, you lose it. For a man that has ED, let's say you haven't had an erection in like a year. Well, that muscle, the penis muscle, hasn't been expanded. There's no blood flow going into that muscle. So what happened? Over time, it could even be months, the muscle start to atrophy or start to get smaller, start to get more fibers, meaning more scar tissue in the muscle. So it's harder for it to expand. It's harder for it to receive more blood flow. You don't use it, it's not being used, so it's atrophy. So that's how shockwave helps to restore the muscle elasticity. Platelet-rich plasma restore more muscle tissue doing Kegel exercises. On Kegel exercises, how do you do Kegel exercises? Like the muscle that when you urinate, if you stop the stream of your urine, is when you actually, that's how you do Kegel exercise. When you urinate, stop, open, stop, open. Those muscles are the muscles that are between your scrotum to your rectum. So, and those are the muscles that are activated when you have orgasm and when you ejaculate. And it actually helps with your erection as well too. And if you do Kegel exercise, that will help with your erection. It help with the penis muscle. And using the penis pump, just a manual or an electric penis pump, because the penis pump, what it does is that it creates a negative vacuum that will bring in more blood into the penis muscle expand, and the penis muscle actually get oxygen. So if you're not getting an erection, you're not getting oxygen to the penis muscle. And then again, Botox, again, how it works is that Botox increases nitrous oxide and also will relax the muscles as well. So shockwave therapy, urology are saying that this is going to change the future ED. Now, I do want to point out that the focus shockwave, which you see here on the top, focus shockwave is the class A medical device that only medical doctor able to use in the office. And it's the only one that has been researched and has been documented through research paper to help with ED, not the radio shockwave, which is this machine on the bottom right here, not the radio shockwave machine, because the radio shockwave machine is more superficial. It doesn't have as much high energy. There's no research that has said that the radio shockwave help with ED. And I know you guys have, the one that is the home use one. The home use one are actually not quantified as shockwave machine. It's more pulse therapy because it doesn't use sound wave. It's just pulse therapy with the bullet that goes in and out of a path that creates kind of like trauma to the penis muscle. And when it does create that pressure to the penis muscle, it kind of causes like some healing that may be occurring in the penis muscle. Again, no research and no that has been written about the home shockwave unit, or no research about the radio shockwave, what you hear like the Gainswave shockwave. All the research that's on shockwave is really through the focus shockwave. So I hope that you all see that, because this is only can be done in the doctor's office. And this is the focus shockwave. Focus shockwave is treated on the penis and also the muscle below the scrotum to the rectal as well. So there's 7 areas that is treated. And this is platelet-rich plasma, or PRP. How do we get that? We get that from your veins in your blood. And then we put it in the centrifuge. And then the blood gets separated into 3 layers. It's called the platelets. And here's a picture of it right here. So this is the PRP, which is the layer between the red blood cells. This is the red blood cell on the bottom. And the top part is called the plasma. And platelet-rich plasma, or PRP, which comes from your blood. What it does is that it creates new blood vessel. You see that on top? It creates new blood vessel, cell growth, new collagen, and it turns stem cells into the tissue. And then there's Botox, 100 units goes at a time into, and it's injected into the penis. And then there is testosterone. Testosterone not injected into the penis. Testosterone is injected, on your buttock, or you can get testosterone through a pellet form, which is implanted and put underneath the skin on your buttock. And diet and exercise. I talked about that, the Mediterranean diet. Exercise, high intensity interval, or just walking, sleep 7 hours a day, and water. This system here, I have an app that you can access that will let you track your water, your sleep, and your movement, and tell you when to eat and what to eat. Nitrous oxide. This is the brand that I advocate, which is nitric oxide beads, which is the powder, and then the lozenge at this time, and then the penis pump. Now, again, This is Bobby. He failed with Viagra and Cialis. He couldn't get the performance he wanted after the treatment, and also due to really coaching, he is now able to restore his functioning again, and he's only 50. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.